somebody well known to most of us, our local member from MacKillop, Mitch Williams. And Mitch, after the last weekend, might be even closer to a miracle. So let's hope you bring it.
Thank you, John. Thank you, ladies and gentlemen. Ladies and gentlemen, I'm delighted. Isabel won't that up. I was delighted a couple of days ago when I learned that Isabel was going to come down here tonight, and I think it's important that we in politics understand at the ground level what's going on. I'm really disappointed that John Hill isn't here tonight. I heard him on the radio a couple of days ago, and he made a comment that he wouldn't be coming down here because he thought he would just get abused. A number of people out of this community have taken their time to re-educate me from time to time, or make sure that I understood what was going on. I don't think I've ever been abused. I don't see why John Hill would be abused if he came here, but I think he would have been re-educated. I think he would have learned something if he came here and heard the passion expressed by the people who've been here addressing you tonight about this community. He would have, I think, learned something about the portfolio that he administers. The fact that he's making some dumb decisions, because he is making some dumb decisions. And I just want to go through a couple of pieces of information to reinforce that. He's been claiming at every opportunity on public radio and TV that he's a good minister and this government's pouring more money into country health. He said we've increased country health funding by 13% this year. This is the 9th budget of this government. It's the first time that they've increased country health budget by anywhere near 13%. Generally it's been increased at the CPI, about 3%, when we know that the cost to provide health services is rising between somewhere between 9 and 12%. So in fact, country health budget has been cut in real terms year on year on year for the last 8 years. This year it has been increased substantially, but that's not held in Keith. He goes on the radio and he says, we've been funding 3 public health beds at Keith and only one of them's been occupied. We've been paying for something, we've been paying for a service that we're not getting. Now, out front earlier this evening I ran into Mike Lowby. I remember it was probably 10 or 12 years ago and I was just a new and fairly green member for this electorate, and I got a call from Mike, who was then the chairman of the hospital board, and the hospital was going through some tough times and things weren't looking too good as they projected forward. And I arranged a deputation from the hospital board to go and meet with then Minister Dean Brown, the Minister of the Health, and we put the case very strongly that the Keith community was subsidising the health system in South Australia. We heard the numbers from Richard Vickery a few minutes ago about the amount of public dollars that go into providing health in this community relative to every other man, woman and child in this state. This community is subsidising the health system in South Australia. We made that argument those 10 or 12 years ago, and Dean Brown, in his wisdom, accepted the argument we put, and he never ever said, I will fund 3 public beds. What he said was, in recognition that if that private hospital closes at Keith, all of the patients, not some of them, all of the patients will most likely end up as public patients in the system, and it's going to cost me a lot of money. I'll make you a deal, I'll give you the equivalent of 3 public beds in a funding grant and see how you get on. And the hospital's done quite well ever since, and it's only been, again as Richard said, in recent years that the future is looking a bit grim. And we attempted to go back and remake that case, because I would argue that this community continues, it has even during that period, significantly subsidised the rest of the health budget in this state. It's really interesting, the budget provided very little good news for country South Australia. But one of the things in the country health part of the budget, there is a line where they have, and it's, I want to Percentage of patients charged for admissions, and there's some numbers there, and the explanation says this is an indicator we use to see how many of their patients coming into our public hospitals in country South Australia pay their own way. What I mean is come in as private patients. In 2008-9, 11.9% of the patients going into the public health system in regional South Australia went in as private patients. And the budget listed that in the following year, they set a target, that's the year just completed, to get that up to 16%. It actually went down to 11.3%, so it went from 11.9 to 11.3%. But undeterred, the health department says, so we'll set the target at 16% again for next year. The Keith Hospital achieves 80%. In excess of 80% of the people that go into your hospital from this community go in as private patients. If John Hill could achieve anything like that, he wouldn't have any problems funding his health system. I would suggest that John Hill would be a lot better off if he sacked some of his bureaucrats and came down and got some of the people that have been working on your board for the last 20 or 30 years. Ladies and gentlemen, we know the statistics show us that the health outcomes for country people are less than what they are for city-based people. We get sicker more often and at younger age, and when we get sick, we cost the system more money. A lot of that is to do with lack of accessibility. It is that we don't go to the doctor regularly enough. We put up with our aches and pains for too long. We don't seek the primary health care which we probably should. That is costing the system more money. The closure of the Keith District Hospital will exacerbate that. It will exacerbate that. And that's happening not just in this community, but it's happening right across regional South Australia. One of the other things that I learned from Dean Brown when he was the Minister for Health, because Dean Brown had a good understanding, as Isabel and I and our members of the Liberal Party have a good understanding of the way things happen in country areas. Dean Brown knew that it was going to be very difficult to keep country hospitals, standalone country hospitals, open because of the cost structures. And he instigated a process where we integrated aged care. We integrated the medical clinic. Just the model that you've got here in Keith is exactly what health department in South Australia, certainly under Dean Brown, and by and large under other governments too, in the last 20 years, has tried to do. Because of the recognition that you can't provide aged care standalone, you can't provide acute care standalone, you can't provide accident emergency standalone, you can't provide GP services standalone in small communities. But if you put them all together, it works. It has worked very well in Keith. It has to continue to work. Ladies and gentlemen, I am delighted at the number of people who have come along here tonight to support their hospital. I'm not surprised, because you've supported your hospital, as the stories have told, for many years. But this is the start of the fight. It is a fight that we cannot afford to lose. I urge you, as Isabel did, to, if you could possibly do it, come down to Adelaide next Wednesday and rally on the steps of Parliament. We're expecting support also from Moonton and Ardrossan, communities that are facing similar situations to yourselves. And people like James, Richard and other people from this community have done a great job raising this as an issue in the city media. It's reasonably easy, and I'm delighted that WIN TV are here from this region, but we need to get this message through to the city media so as it comes home to John Hill, Mike Brand, Kevin Foley. So one of the ways we can do that is if we can get as many as possible from this community and those other affected communities, and I'm sure there'll be support from other communities that aren't immediately affected because they see this as the thin end of the wedge as well. So do what you can to get down to Adelaide, and we will keep fighting, and hopefully, well, we have to win this battle. Thank you very much.